So good morning, ladies and gentlemen. First of all, I would like to thank the American Society of Hematology for giving me the opportunity to present this study on behalf of all the investigators and the study team. This is a multicenter, randomized, double-blind, placebo-controlled study of the efficacy and safety of Siltuximab, an anti-interleukin-6 monoclonal antibody in patients with multicentric Castleman's disease. Multicentric Castleman's disease is actually a rare disease which is generally considered as a benign tumor of the lymphocyte, which is a kind of white blood cell in the body. In MCD, patient has got an overgrowth of the lymphocytes resulting in enlargement of the lymph nodes and a variety of symptoms including fatigue, fever, night sweating, poor appetite, and weight loss. This disease doesn't only have impact on the patient's quality of life, and is also potentially fatal. We now understand that interleukin-6 has a central role in driving the signs and symptoms of MCD. Siltuximab is a monoclonal antibody specifically targeted at the human interleukin-6 and blocks its function. So this is the first and only multinational randomized double-blind placebo-controlled study in MCD. This is indeed a truly international study as we have included 38 sites from 19 countries across the world. So patients with MCDs who fulfill the inclusion and exclusion criteria were actually randomized in a ratio of 1:2 to receive either placebo or Siltuximab. All patients are also allowed to receive best supportive care to relieve the symptoms. And the primary endpoint is durable tumor and symptom response, which lasts at least 18 weeks. This slide summarizes the efficacy data of this study. As you can see here, about 34% of the patients, that means 1 out of 3 patients treated with Siltuximab, actually achieve a durable tumor and symptom response for at least 18 weeks. And these responses were actually assessed by very stringent criteria using a central review setting. As you can see down in the bottom of this table, you can see that 1 out of 4 patients actually achieve a durable complete symptom response. That means all the symptoms related to MCD disappear for at least 18 weeks in the Siltuximab arm. This is a very exciting result, as you can see, because none of the patients in the placebo arm actually achieve a durable tumor and symptomatic response or durable complete symptom response. And the time to treatment failure in patients who receive placebo have a median of about 134 days, while the median time to treatment failure was actually not reached in patients who received Siltuximab. For those patients who got anemia before they will start on treatment, in the Siltuximab arm, about 61% of them showed a significant increase in the hemoglobin level by at least 15 grams per liter or 1.5 grams per deciliter by 3 months of treatment. Again, none of the patients who received placebo has shown a significant improvement in the hemoglobin level. This slide summarizes the changes in disease-related laboratory parameters. As you can see here, if you look at the blue lines, you can see that patients who receive Siltuximab show a rapid and significant reduction of all the inflammatory parameters, including C-reactive protein, fibrinogen, and also the ESR. Well, if you look at the red line, those patients who received placebo did not show any significant reduction in all these inflammatory parameters. As I've discussed, patients who received Siltuximab actually showed a significant improvement of the anemia and increase in hemoglobin level, while patients who received placebo did not show any significant improvement in the anemia and an increase in hemoglobin. So this slide summarizes the safety data. Basically, the frequencies of adverse events, as well as the more serious ones, appear to be similar between the placebo and also the Siltuximab-treated group of patients. But I have to highlight that patients actually receive Siltuximab for a much longer period of time, actually more than double the duration of treatment with placebo. So you can see that the safety profile of this drug is actually very good, and it may potentially be even better than placebo. So ladies and gentlemen, in conclusion, I've presented the first and only randomized study in patients with multicentric Castleman's disease. In this study, the efficacy of Siltuximab in MCD patients was clearly demonstrated as evidenced by durable tumor and symptom response. Clinical benefit was confirmed by marked improvement of time to treatment failure, reduction in MCD-related symptoms, improvement in hemoglobin levels, and sustained reduction in inflammatory parameters. As I've discussed, Siltuximab appears to be well tolerated, and there was no increase in adverse events over placebo despite a much longer duration of treatment. These results are very exciting and highlight the potential for Siltuximab to be a new and valuable treatment option for MCD patients who unfortunately, until now, had no approved treatment options for them. This is the end of my presentation. Thank you very much for your attention. I'm happy to take your questions later. Thank you.